Godha wa mgothe. Laikipia, we are coming to ban anything that we will see there for quarantine. What is quarantine? What is quarantine for? In which country? Anything that we will find in Laikipia, we are coming to ban all of them. Ruto, sisi zile kuku za sogoi zenye ulikuwa unauza. This is Kenya, my friend. This is another world, bro. Sisi zile kuku ulikuwa unauza sogoi. Hii ni Kenya, my friend. Kitu yote tukipata hema yote hapo Laikipia, imewekwa ati Ebola for what? For stupid, for idiot. We are coming to ban all of them. To ban them. Ban to fit. Kai, mwadhani. Yani, surely. Yani uketu chini for your own benefit. Ati you want to kill Kenyans because umetugeuza zile kukuliku unauza sogoi William Ruto. Anything in a deal na mali wamekati quarantine ya sijui Ebola ya matakataka ya umafi na nini. We are coming to ban all of them. To ban. I mean banning.
Mongbualu Hospital near the DRC's eastern border with Uganda is at the center of the Ebola outbreak. The facility was attacked.
Machaji na manyonyo sitimue cheche. Mbona mtu akomenda tiyo facility ya Ebola ijengwe huko Sugoi? Ati jengwe area ya Tutam. Ache ni jokes zingine bana. Usitake jua.
Ama wanaleta watu wa Ebola, ndo tukiandamana wafungulie. Halo, watu wangapi wanaona hii kitu nimeona? Hauwezi anza kuleta watu wa Ebola tu hivyo saa ile tunafikiria kufanya manini. Halo, watafunguliwa wewe hapo ukiwa unarusha mawe utaanza kukunia damu.
Meanwhile, the Ebola outbreak in the Democratic Republic of Congo and Uganda has raised concerns across the East African region, with Kenya now heightening surveillance and preparedness measures at its border points. The Ministry of Health maintains that Kenya is adequately prepared and has set up enough screening and isolation centers, as well as enough human resource trained on handling Ebola. Here's NTV's Helen Aura with what we know so far.
According to the World Health Organization, the latest outbreak caused by the rare Bundibugyo strain of Ebola has so far seen over 600 suspected cases recorded in the DRC and over 130 suspected deaths, with dozens of cases already confirmed. Uganda has also confirmed at least 2 Ebola cases linked to travelers from the DRC. The outbreak has prompted the World Health Organization to declare the situation a public health emergency.
Currently, Ebola is a regional risk. It's not a pandemic. It's a focal epidemic, particularly in Eastern DRC. But it's a regional risk and concern. That's why it's been declared public health emergency. A public health emergency of concern, of international concern, is because of the movement. People moving from DRC to Uganda, Rwanda, Kenya, the high mobility, and because of the high infectivity rate, it means it can easily spread.
Kenya has an established isolation and treatment capacity for viral hemorrhagic fever management, including Ebola. And there is a national viral hemorrhagic fever treatment unit at Kenyatta National Hospital, which is operational and is available for management and confirmed cases. In addition, the counties and points of entry have also identified holding areas and isolation spaces for temperature management and assessment of suspected cases before referral.
Public health experts say Kenya's preparedness will largely depend on early detection.
The lab that's supposed to conduct this test has to be at the highest biosafety level, which is biosafety level 4. Because most labs are at biosafety 1 or 2, which means you can go into the lab, they have, like the environment, they have the hoods, that will be biosafety 2. Like in our lab, we are biosafety 3 because we have special hoods where you can handle TB, for example, and it will not infect you, and the technologies, they know how to. But biosafety level 4, you actually require a much deeper level of, or higher level of security. The labs that actually handle Ebola is Kemri Nairobi, Kemri Kisumu, and National Public Health Lab.
The Ministry of Health has also intensified issues of traveler screening at all points of entry. And this one I want to emphasize for the officers who are manning the ports of entry. Nobody should enter into the country without being screened.
Ebola is a severe viral disease spread through direct contact with bodily fluids of infected persons or contaminated surfaces. Symptoms include fever, vomiting, diarrhea, fatigue, and, in severe cases, internal bleeding. Health experts, however, maintain that there is currently no confirmed Ebola case in Kenya, but emphasize that preparedness remains critical due to increased regional movement and cross-border trade. Helen Aura, NTV.
Attacked by young men demanding that the bodies of relatives who died be handed over to them. Medical staff were forced to evacuate the site, and tents put up by the aid agency Doctors Without Borders were burnt to the ground. The hospital's director says the violence has made an already desperate situation even more difficult.
There has never been an epidemic of this magnitude in the region. There have been rumours, people are saying the disease came from this or that person. And now they have turned words into actions. By burning down the facilities, they're slowing down our response to the contamination and our efforts to break the chain of transmission.
The bodies of those who have died from Ebola are highly infectious. With no vaccine or treatment for the latest strain of the disease yet available, doctors and nurses treating cases are themselves in danger of becoming infected.
The medical staff here are not trained to care for Ebola patients. That's why they're at risk of contracting the disease, since they don't know how to protect themselves.
Several patients absconded during the fire, vanishing back into the local community, and that has deepened the climate of fear. Health workers are...
Nimeona hizo signs and symptoms za Ebola. Miki tumine za sema 2027 ni heri hata hiyo kiti basi baki single. Hawezi kuja kuquarantine watu wa Ebola bana Kenya. Watu wenye wanakaa hivyo bana. Juu ya pesa. Sasa unawezaje anza kulinganisha life ya mtu na doo? Sasa hii Kenya watu wakikufa wote utalead nani? Juu umepewa pesa ya Ebola. Saa hii ni one time mpaka kwa chief kama analeta ujinga na ni wa UDA pia chief akuwe one time. Saa hii ni kurectify makosa, Kenya ikae straight kwa kabiro. Juizi mambo zenye mnafanya hata mtu mwenye ana akili timamu hawezi fanya. Kama sasa bei ya mafuta pekee imekuwa shida kucontrol. Sasa Ebola ndio mta control jameni. And watu wenye wako exposed ni wale watu wenye hawana kakitu, because the Ebola, wale watu wenye hawana kakitu they wanafanya too much of kuzunguka ndio watafute kitu wanaweza pata waeke kwa meza. Nyinyi kazi yenu ni kuamka, kuingia kwa magari, kutembea. You are not exposed to Ebola, na hata mkikuwa exposed bado mnaweza enda majuu mtibiwe. Mtu wa ule wa chini ule ataenda wapi? Hiyo kiti hairi baki single bwana.
Hizo shida zote zenye tuko nazo kama Wakenya alafu tunaongezwa Ebola. Na hizo shida zote zenye tuko nazo kama Wakenya alafu tunaongezwa Ebola. Sasa wamefungua tibezi huko hivi quarantine sijui Laikipia. Ati mnaokolea watu wa US. US wenyewe wameshindwa na Laikipia, ati Kenya ni sisi tunaokolea. Tumefika wapi yenyewe tu kama Kenya jo? Hizi shida zote alafu bado tunaongezwa shida zingine juu. Kwani tumeingizwa Illuminati? Hata kama mnataka kutuua, mnatuua design nyingine jo. Kwani mnatumaliza aje hata nyinyi? Tutafanya kitu kuhusu hiyo shughuli. Fully another.
Hatutaki quarantine hiyo imependekezwa ati itaanzishwa katika Laikipia County. Gavana wa Laikipia Joshua Irongo ameruka hiyo story ya quarantine. Amesema hakuwezekani ati ugonjwa itolewe Amerika, ingine itolewe Kongo na nchi zingine, ati wote wawe wanaletwa Laikipia. Na Laikipia yenyewe hata haijaripotiwa kuwa na ugonjwa kama huo. Yeye mwenyewe amekataa na amesema wao kama viongozi wa Laikipia watafanya juhudi juu chini kuhakikisha hiyo kitu inaitwa quarantine yenye inajengwa haitajengwa Laikipia. Just listen to his voice.
Kubaliana kama viongozi na kama wakaaji wa Laikipia County, hatutaki quarantine hiyo imependekezwa ati itaanzishwa katika Laikipia County, kwa sababu hiyo ni kutahadisha, it is to expose our people of Laikipia kwa mambo ya Ebola which is not there, so inakuja kuwa introduce katika Laikipia County. Sisi na kule inafaa inasemekana itawekwa, tuko na uhusiano ni ya kwamba kuna watu wetu wanaingia kule wanafanya biashara na nyuki, na kwa hivyo hii
Ruto sasa hii hata shetani yenyewe amemwacha afanye kazi Kenya. Shetani sasa anaenda huko nchi zingine. Hapa Kenya ni Ruto afanye kazi kwa sababu yeye ni rafiki na shetani wameungana hivi. Kenya wanaumia. Hebu maji mtu anataka kuongeza mkate. Mkate ukisoma hata kwa Biblia, Yesu alilisha maskini watu na mikate na samaki, lakini huyo jamaa anaongeza. Huyo mtu ni mtu wa Mungu. Hakuna. Umejivalia ngozi ya kondo.
Running information campaigns in the hope of gaining people's trust. And in the city of Bukavu, there's been a surge in demand for hand-washing stations and other hygiene installations. Nonetheless, the World Health Organization is warning that the Ebola epidemic is outpacing efforts to contain it, and the situation will get worse before it gets better.
More on this. We're joined now by Christian Katza. He's the director of Doctors Without Borders Germany. Thanks for being with us. Christian, the head of the World Health Organization says at the moment the epidemic is outpacing us. Have authorities underestimated the danger of this Ebola outbreak?
I don't think they have underestimated it, but it's because of the nature of the extent and the circumstances of the outbreak which makes it going out of control currently. Authorities have tested for Ebola virus, but they haven't tested for the current virus, and therefore the outbreak went undetected and made it very difficult to intervene initially. Now we know which virus we are dealing with, and therefore we hope that there is still chance to bring that outbreak under control, even though we assume that the outbreak has spread, and we are talking of probably more than 1,000 infected people right now.
We keep seeing those numbers of infections and the deaths rising. What do medical teams on the ground need right now to get this epidemic under control?
So what we need is actually supplies for protective material. We need tents and other construction material to be able to isolate patients. And we need a lot of staff to actually bring in community acceptance and infection control in communities where safe burials, the follow-up of contacts, etc., is essential to curb the outbreak. And what we also need is much more diagnostic capacity, especially in some areas of the Democratic Republic of Congo where the central lab in Kinshasa is still to confirm samples taken, and that travel time and gives huge delays, as we have other diseases in the area which also bring fever and symptoms similar to the one of the virus, of the Ebola virus, and therefore a quick detection of those cases who are actually confirmed positive of Ebola virus would be very important.
Now, there have been several attacks reported on healthcare facilities in the affected area. Why are some people there angry at the very people who are trying to help?
There's a number of reasons, including the whole area we are talking about is actually prone by conflict and displacement. So people are by nature very careful to trust authorities. The second one is that actually healthcare facilities in the area are not very well functioning. If people seek healthcare there, they often have to pay, and the care they get is not often good. So there is some people try not to go into health facilities. And the other one is actually that, and we have seen it also in the pandemic in many other places, that people don't trust necessarily what comes from central government or authorities in terms of information. They don't believe that the disease is really there, and they prefer to continue with their life and do not see that major outbreak impacting their own lives. So these three factors, I think, play a key role in the beliefs of people, and that's what I meant with community engagement. We really have to see that we get the message across that this disease is fatal and can impact everybody, but there's ways to prevent spreading, which includes just avoiding body contact. So it's a bit easier to prevent transmission than in, for instance, SARS-CoV, what we have seen around the globe a few years back.
Well, the virus does indeed seem to be spreading. How high is the risk of the outbreak spreading to other countries? There are already cases reported in Uganda.
Yeah, so overall, as I said, the transmission is not that easy, so that will make it almost impossible for it to become pandemic. But we will see numbers going up. Definitely, we will definitely see other parts of the Democratic Republic of Congo seeing cases, because people are very mobile. It's a mining area where the major part of the outbreak is right now. So people are mobile. They have gone there to work. They will go back to the places they came from. And I would also suspect that we unfortunately will see some cross-border cases, so going into other countries, because as I said, healthcare is not very good in that area, and people who can afford it would probably try to seek better healthcare outside the region where they are now in.
Congo has experienced, the Democratic Republic of Congo has experienced many Ebola outbreaks in the past. Shouldn't it be better equipped to respond to these crises we're seeing today?
So overall, what we see on the ground is that the health authorities are equipped.